Are you struggling with low back pain? Or that burning sciatica that shoots down your leg? In today's video, I'll guide you through safe and effective sciatica pain relief exercises designed especially for senior health. These gentle movements help improve mobility, reduce inflammation, and protect your spine for the long term. We'll cover the best sciatica healing exercises you can do at home with no equipment and essential spine care habits. If you deal with sciatic pain that worsens when standing or walking, this routine will help you finally find relief. You'll also learn how physical therapy techniques target the sciatic nerve, and how simple daily habits can prevent piriformis syndrome, one of the biggest hidden causes of chronic sciatica pain. I'll even show you how to do sciatic nerve flossing, a powerful technique widely used in rehab to decrease pressure on the nerve. If you want a stronger, healthier body, these exercises will help you tone and tighten safely while protecting your spine.
Sciatica has a reputation for sounding mysterious and unstoppable, but in truth, it's one of the most predictable pain patterns in the human body. And here's the twist. While it feels like a leg problem, nearly all sciatica originates in the spine or deep hip muscles. When seniors remain inactive, joints stiffen, muscles tighten, and the nerve loses glide, making symptoms worse. What you are about to learn flips that script. Proven exercises that restore movement exactly where the nerve needs space. Now let's dismantle the myth that confused millions.
Myth 1. Rest will fix my sciatica. Not true. Resting makes it worse. The sciatic nerve hates stillness. When you stay in bed or sit for long stretches, the tissues around the nerve tighten, inflammation builds up, and symptoms intensify. What helps is controlled, gentle motion. Myth 2. All sciatica requires surgery. No. Between 8 to 9 out of 10 cases improve without any procedure at all. Strengthening the hips and core, improving flexibility, and restoring posture often reduce the nerve irritation naturally. Myth 3. All stretches help sciatica. Actually, wrong moves can increase pain. For example, someone with spinal stenosis often feels better bending forward, while someone with a disc bulge often feels better bending backward. That's why we use universal, senior-safe exercises that work across most causes. And myth 4, pain down the leg means it's always sciatica. Sometimes leg pain comes from hip arthritis, circulation issues, or muscle strains. But if your pain burns, tingles, or shoots from the low back or buttock downward, these exercises likely apply. Now that the fog is gone, let's dive into the actual solution. The 5 physical therapy exercises that deliver instant and reliable relief.
Picture this. Your sciatic nerve is like a thick cable that needs room to move smoothly. Aging, stiffness, and long sitting cause that cable to get pinched or stuck. The exercises you're about to learn create motion exactly where the nerve needs it, in the pelvis, hips, hamstrings, and lower spine. Think of it as making space in a crowded hallway. Once the hallway opens, pain has fewer places to hide. Let's begin the routine.
Exercise 1. Pelvic tilt, spinal warm-up. The pelvic tilt is the foundation. It gently activates your deep core, flattens the lower back, and reduces pressure on the nerve roots. Think of it as unlocking the spine so the rest of the exercises work better. Lie on your back with your knees bent and feet flat. Slowly tighten your belly like you're trying to zip up your spine and tilt your pelvis so your lower back presses into the floor. Hold for 5 to 20 seconds, breathing normally, then release. Repeat 10 times. This motion is subtle. It shouldn't feel like a crunch or a big push, just a smooth flattening. If getting on the floor is hard, do this in bed. If your neck gets tired, use a small pillow. The whole goal is to warm the spine and gently reduce stiffness before we introduce stretching or strengthening. This one is so simple, but for many seniors, it's already enough to reduce symptoms. Once this area loosens, the nerve stops being tugged every time you move.
Imagine your lower spine as a hinge that has not been opened in a long time. The pelvic tilt is the oil that begins to restore its smooth motion. Even 5 repetitions begin to hydrate the joints, relax protective muscles, and decrease nerve irritation. With the spine warmed, the next exercise lifts your body and your results to the next level.
Exercise 2. The bridge. Glute strengthening. Seniors with sciatica almost always have weakness in the glutes. Strong glutes protect your spine, stabilize your pelvis, and reduce stress on the lower back. The bridge is the safest and most effective way to strengthen them without overloading joints. Start by lying on your back with your knees bent. Press your heels into the floor, squeeze your buttocks, and slowly lift your hips until your body forms a straight line from shoulders to knees. Hold 5 to 10 seconds, then lower with control. Work up to 8 to 10 repetitions. If your hamstrings cramp, lower your range and try again. If you feel pressure in your lower back, reduce the height. You're not trying to rocket your pelvis toward the ceiling. You're simply strengthening the muscles that hold your spine stable. This exercise also opens the hip flexors, which tend to shorten with age, sitting, and inactivity. When the hips loosen and the glutes strengthen, your sciatic nerve finally gets the supportive environment it needs to calm down.
The bridge is more than a strength exercise. It is a protective mechanism. Strong glutes lift stress off the very segment of the spine that compresses the sciatic nerve. It is no coincidence that seniors with firm, activated hip muscles walk better, stand taller, and experience fewer flare-ups. The next stretch targets one of the biggest hidden culprits behind sciatic pain.
Exercise 3. Seated hamstring stretch, nerve mobility booster. Tight hamstrings are notorious for worsening sciatica. When these muscles shorten, they pull on the pelvis, which increases nerve tension. But seniors often struggle with standing stretches, so here's a safer version. Sit on the edge of a chair. Straighten one leg with the heel on the floor and toes pointing upward. Keep your back straight and hinge forward from your hips, not your shoulders. Once you feel a gentle pull behind the thigh, hold 20 to 30 seconds, breathe deeply, then return to upright. Switch sides. Repeat 3 times per leg. Never bounce, never force the stretch. The goal is gentle lengthening. Even a small lean is enough for many seniors. Over time, this stretch reduces pressure on the sciatic nerve and allows it to glide freely during walking. If you only do one stretch daily, a hamstring stretch like this is one of the most impactful.
The hamstring stretch is deceptively powerful. When this muscle group relaxes, the pelvis resets into a healthier position and the nerve gains slack. Imagine easing tension on a tight rope. That rope instantly becomes less reactive, less painful, and less inflamed. But the next exercise targets the true hidden villain, the piriformis.
Exercise 4. Piriformis figure 4 stretch. If your sciatica feels like it starts deep in the buttock, you may have piriformis involvement. This muscle sits directly over the sciatic nerve, and when it tightens, it squeezes that nerve like a vice. This stretch gives immediate relief. Sit tall in a chair. Cross the ankle of the painful side over the opposite knee, forming a figure 4 shape. Let the knee relax outward. Slowly hinge forward until you feel a deep but comfortable stretch in the buttock. Hold 20 to 30 seconds. Switch sides and repeat 2 to 3 times. If your hips are too tight to get into this position, simply cross the ankles and lean forward. Or perform the stretch lying on your back instead. This single movement can make a dramatic difference for seniors whose pain starts in the buttock and radiates downward. It loosens the muscle that compresses the nerve, giving you the space you need to finally move without that stab of pain.
The piriformis stretch is often the turning point. For many seniors, this deep muscle has silently caused months of misery. When it lengthens, the nerve breathes again. Symptoms that once shot down the leg often melt into a warm, loosening sensation. But the next technique is the true game changer, a direct glide of the sciatic nerve itself.
Exercise 5. Sciatic nerve flossing, the nerve glide. This is the movement many doctors never mention, yet physical therapists use it daily. Nerve flossing does not stretch the sciatic nerve. Instead, it gently slides it through the surrounding tissues so it stops catching, tugging, and inflaming. Sit in a chair, slowly slump forward while straightening one leg. Your head lowers, shoulders round, and knee extends. Stop at the first gentle stretch, no forcing. Then reverse, bend the knee, lift the head and chest, and return to the starting position. Perform 10 to 15 slow repetitions. Switch legs if needed. Never hold this stretch. Nerves do not like long tension. The motion should feel smooth, rhythmic, and almost soothing. Seniors often notice that after several repetitions, the leg goes straighter with less discomfort. Use this exercise especially when your symptoms are mild to moderate. Avoid it during severe flare-ups.
Think of nerve flossing as untangling a cable that has been stuck behind furniture for years. Each gentle glide frees the nerve, restores blood flow, reduces inflammation, and lowers the intensity of that electric pain. When combined with the previous 4 exercises, it becomes a complete system of relief. Now let's lock in your results with essential habits every senior should know.
Exercises help, but your daily habits determine whether pain returns. Here's what seniors must get right. First, avoid long sitting. Every 60 minutes, stand up and gently move your hips. Sitting compresses the nerve and tightens the piriformis. Second, never sit on a wallet or anything that lifts one hip higher. This asymmetry is a major cause of piriformis syndrome. Third, posture matters. Keep your ears over your shoulders and your shoulders over your hips. A small lumbar cushion helps maintain natural curves. Fourth, walk. Even 5 minutes a few times per day increases flexibility, circulation, and nerve glide. Fifth, listen to your body. If a movement consistently decreases your pain, that is the movement your body needs more of. If something aggravates symptoms, adjust the angle or reduce the range. These simple habits multiply the benefits of the exercises. A few days from now, you may notice easier walking, smoother standing transitions, and fewer sharp zaps through the leg.
Small habits build big results. Seniors who combine gentle exercise with smarter posture, consistent walking, and avoidance of long sitting often report remarkable improvement within 2 to 6 weeks. Pain fades, confidence increases, and the fear of movement, one of the greatest obstacles, begins to disappear. But let's ground all this in expert guidance.
What experts across the country agree on 3 powerful truths about sciatica relief. Truth 1. Exercise beats inactivity. Targeted movements reduce inflammation and restore nerve mobility far better than bed rest. Truth 2. Strength and flexibility protect the spine. Weak glutes and tight hips are 2 of the strongest predictors of flare-ups in seniors. Truth 3. Most people recover without surgery. Conservative care helps the vast majority of cases improve within several weeks to a couple of months. And remember, your routine does not need to be perfect. You just need consistency. Seniors who follow these exercises daily often report less pain, stronger legs, better posture, and more confidence walking or standing for long periods. You're retraining your body to support you, not fight against you. And that transformation is incredibly empowering.
Your journey does not need to be dramatic to be successful. The seniors who recover best are not the ones who push hardest, but the ones who show up daily with gentle consistency. One stretch at a time, one breath at a time, one walk at a time. Relief is the accumulation of small victories.
If you've made it this far, your recovery has already begun. You now understand what sciatica is, what fuels flare-ups, and which movements release the pressure on your nerve. You have a 5-exercise routine you can perform morning or evening, plus daily habits that reinforce your progress. Remember, you are not fragile. Your body wants to heal. Give it motion, consistency, and patience, and you'll be amazed at how quickly your mobility improves. If any of today's exercises gave you relief, tell me in the comments which one hit the spot. And if you know a friend or family member struggling with sciatic pain, this video may help them too.
Relief is not a mystery. It is a method you now possess. Use it daily. Honor your body's signals and watch as tension melts, stride length returns, and confidence rebuilds. This is the beginning of a more mobile, more comfortable, and more independent chapter of your life. Stay consistent, and your sciatic nerve will thank you.